Hello everyone and welcome to my online human anatomy lecture. In today's lecture, we're going to talk about the female reproductive system. I am Dr. D, and without further ado, let's go ahead and get started. Okay, so here are some of the functions of the female reproductive system. Okay, one of the functions here is to produce gametes, and gametes is a general umbrella term that describes either sperm or egg. And of course, in the female reproductive system, we're particularly talking about the egg. Okay, now ova here is the plural form, ovum is singular. Okay, so again, gametes is the umbrella term for sperm or egg. Okay. Now, the function of the female reproductive system also includes preparing to support a developing embryo, as well as undergoing changes according to the menstruation cycle. Now, here are some of the parts of the female reproductive system. It includes the ovaries, which are the primary sex organs. Okay, these are the primary. It also contains the famous fallopian tubes, or modernly known as the uterine tubes. There's the uterus, the vagina, and all the external reproductive genitalia. Let's start with the first, the ovaries. Once again, these are the primary sex organs, okay? Now, the ovaries are small, almond-shaped, around 1.5 to 1 inch in dimension, and they're found within the peritoneal cavity on the posterior body wall. Now, here's the thing. They are held in place by ligaments so that they don't flop around. You know, say, for example, someone is going for a jog or for a run or on the treadmill. They don't want the ovaries to be flopping all over the place during the run, and so they need to be held down by these ligaments. Okay, one of the ligaments here is the broad ligament, and the mesentery called the mesovarium. There's also the suspensory ligament that holds the ovary upward superiorly, and then you have the ovarian ligament that connects the ovary to the uterus. Okay. Now you also have ovarian arteries, and this is an arterial supply through the mesentery to the ovaries. Okay, so here are some of those structures that we've mentioned moments ago. The ovaries are right here. The fallopian/uterine tube is this long structure right over here. And then we have that suspensory ligament that holds it upward. We have the broad ligaments. And of course, we have the ovarian ligament right over here. You can see that the ovaries are attached to the uterus at that ovarian ligament. There is that suspensory ligament once again. It holds the ovaries up superiorly on the upward direction. Now, if we dissected a cat and we were to look inside a cat, again, the fallopian tube here would be called the uterine horn for cats. Here is an image of the ovary right over here. The suspensory ligament holding it up is right over here. The head of the cat is down this way. The tail of the cat's down to the left. And here's the broad ligaments. Okay, that holds it down too. Okay, and this whole structure here is the fallopian tube/uterine horn in cats. Okay, so here's the internal structure of the ovary. Okay, if we were to slice it in half, we would get this general structure. We would have on the outside here the superficial epithelium. In the centermost here, we would get the ovarian cortex. In the brown region here, we will get the tunica albuginea. The outer portion here is a superficial epithelium. My apologies if I had misspoke. And then in the center right over here in yellow is the ovarian medulla. Okay, now the ovary is lined with the superficial epithelium, also known as a visceral peritoneum, and it is under that is a thin layer made of dense connective tissue called the tunica albuginea. And internal to that is the ovarian cortex, which is where the eggs are going to develop. okay? And the internal to that is the ovarian medulla, right over here, as we mentioned earlier, which is made up of loose connective tissue containing veins, arteries, nerves, and even lymphatics. Here's a nice histology image of the ovaries. You can see here the tunica albuginea. Where's my pen? The tunica albuginea is out here. Okay, we have the cortex, and then you have the center medulla. Okay, so let's talk about the ovarian sex cycle here. Now, this is a process of egg development on a monthly basis, around 28 to 45 days. Everyone's a little different. The eggs develop during the fetal period. That's the thing, though. Men, our sperm cells don't get created until, or made, until we reach puberty. Ladies, for you, your egg cells are created while you're in your mother's womb. Okay? A female is born with several million eggs, and then they start to die, but then around age 35, there are only a few thousand left. And I get a lot of questions every semester asking, wait a minute, if ladies are born with millions of eggs, why is it that the ladies run out by the age of 35? And one of the reasons why is because for every ovarian cycle, okay, it's not one egg that's being released at a time. We're talking 19 to 20 of them being released at a time, give or take a couple more or less. And also, sometimes eggs are released out that are not a response to the regular monthly cycle. Sometimes they are stimulated by sexual intercourse. And then so that we'll talk about later in today's lecture. Now, an egg is called an oocyte. Okay, and the typical diploid cell in your body, like your skin, your heart, your muscles, and everything like that, those have 46 total chromosomes. But when it comes to sperm and egg cells, like gametes, they only contain half of that count, and therefore we call them a haploid, and they only contain 23 chromosomes, not 46. Okay, so a lot of these eggs that are made during a female's time in her mother's womb, a lot of these eggs will get packaged in something known as a primary follicle, okay? And this is an oocyte that is surrounded by a group of cells called that follicular cells, and the whole structure is called the primary follicle. So it's just like these eggs are being made while in the mother's womb, and then they get packaged into this primary follicle, and they stay there until it's time to get released out. At puberty, there is a change in hormones which causes development of some of these oocytes. So you can see here is one immature oocyte, and it's surrounded by follicular cells, therefore creating this primary follicle. And once again, ladies, you're born with millions and millions of these primary follicles. And it's not until menstruation where 19 to 20 of them get selected to kind of mature out, okay? But in the meantime, while they're dormant inside this primary follicle, they remain immature. They're not ready yet. Now, ovulation is a process that occurs halfway through the ovarian cycle, and in this case, the oocyte exits from one of the ovary, and when it exits, it's called an ovum, okay? An ovum, which is an egg cell that has entered, okay, the peritoneal cavity, okay, and has exit the ovary. Okay, so again, this new ovum, it's called an ovum now, has exit the ovary. So it was an oocyte at first, and now it becomes an ovum, and it goes into the peritoneal cavity temporarily. So there's this little gap. Okay, so imagine here being the ovary, and then there's like structure. This is known as a fimbriae, and then there is a fallopian tube. I'm going to abbreviate here as FT for fallopian tube because I don't have room to spell it. There is a moment in time when the egg cell is in this empty chasm, this space. That's a peritoneal cavity. Okay, so when the egg cell busts out of the ovary, they kind of get into this space and then eventually get swept into this fallopian tube, which we'll talk about later. Okay, there's also a luteal phase, which occurs after ovulation. What happens at the remaining follicles, so the sac that the ovum slash oocyte was in, is left behind. Okay, and that ends up becoming something called the corpus luteum. And the corpus luteum is not a garbage. Okay, it's not something that's left over and ends up getting thrown away. It does have a role, and that role here is to secrete out a hormone called progesterone, and it helps to prepare for the implantation of the fertilized zygote or the embryo. Okay, so here it is. There's the ovarian cycle. You can see here, this is obviously not what if you were to slice an ovary in half, this is not what it's going to look like. But this is a very general cartoon that shows you the stages of this primary follicle. You can see here millions and millions of those egg cells, those oocytes, are stored away in these primary follicles, and they lay dormant in there until the time has come for them to come out. And then eventually they mature out to becoming secondary follicles, and then they become a tertiary Graafian follicle, and eventually they bust out. And when they bust out, it's called an ovum now, okay? And then what's left behind is that corpus luteum that will secrete out that progesterone and prepare the uterus for implantation of the zygote. Now, the average cycle here is around 28 days. Again, this is just a rough estimate. There's some that are a little less than that, others that are a little more than that, or maybe way more than that. Again, everyone is different. The female sex cycle, again, we're going to say that we're going to count starting with day 1, okay? Because everyone is different. It's not like it starts on the 1st of every month. Everyone is at a different time. So in this lecture, I'm just going to say day 1 of an average person's menstruation cycle. We'll call it day 1. So on day 1, this is the first day of menstruation, and the primary follicle begins to mature. So again, around 15 to 20 of them get selected, and now that those primary follicles will begin to mature out and develop. Okay, the adenohypophysis, which is the anterior portion of the pituitary gland, will secrete out a hormone called the follicle-stimulating hormone. And again, that causes around 20 to 30 eggs to be stimulated in both of those ovaries. I mean, I said 15, 20 to 30 eggs. Let's go with this lecture. 20 to 30 eggs will get stimulated here. And over the next 7 days, the oocyte develops and the follicle cells begin to grow and divide. So these guys are going to start to mature out. Here's the thing though, obviously, as you guys are probably thinking, wait a minute, if 20 or 30 of these eggs are starting to mature, you can't have 20 or 30 children. That's correct. That would be way too many at that, But it's a race. 20 or 30 of these eggs are going to start to go into this race, and then the first one to make it to the secondary follicle stage is the winner, and then kills off all their other competitors. Okay, so here it is. This is the primary follicle, and this is kind of what it looks like. And the secondary follicle here begins to get larger and mature out. Now, it is called a secondary follicle when it starts to produce estrogen, which we can probably tell this is the female sex hormone. Okay. And estrogen causes a buildup in the lining of the uterus and also inhibits the development of the other 20 to 30 follicles. So all the other competitors don't make it. Okay. This one, the first one to start producing estrogen and has become a secondary follicle, will outcompete all the other follicles that were in the race. Okay. And that would be the chosen one. Like I said, it's like a race that lasts around a week, and the first one to reach the stage of maturation will win, and the rest of them will start to die off. So there's only one follicle remaining. That's why. So, men, we play the game of odds. We produce like millions and millions of sperm. We'll talk more about that in the male reproductive system, and we're hoping that one of them out of the million will make it. Ladies play kind of similar odds too. Instead of having 1 egg per month, they release out 20 to 30 eggs and hoping that one of them will make it, will mature. Okay, so ladies, you play the game of odds too. Men plays the game of odds, ladies play the game of odds too. Now, in some races, there could be a tie, and so that's what happens when someone gets fraternal twins. Okay, not identical twins. There's a difference between identical twins versus fraternal twins, and I'm going to go ahead and write on my whiteboard to kind of show you that. Okay. So identical twins versus fraternal twins. Okay. So identical twins you have an egg here. There's an egg. And then you have a sperm cell coming in. And then you get this zygote. And somewhere down the line, it's split into two. This is identical twin. Fraternal twins is where you have two eggs, two sperm, giving you two different babies that happen to come out at the same time. So I like to describe this fraternal twin as a 2-4-1 deal. Okay, so you have two separate fertilization events that happened at the same time. Okay, and therefore you get two separate children that just happen to be born at the same time. The first one here is where you have one sperm, one egg, and then they fertilize, and while they're multiplying, something happened, and then that whole mass split in two, but it didn't split so late to the point where it wouldn't make a baby anymore. It split early enough where the two of them can develop into their own babies independently. So in this case, okay, in the identical twins here, the DNA genome should be identical. Okay, in fraternal twins, the DNA genome is different. Okay, the DNA genome is different when it comes to, because you have two different ones. I mean, you know, if you were to have two brothers or two sisters, or brother and the sister that were born at different times, you don't see that they look identical. Identical, do they? Sometimes you have some differences in there. When it comes to identical twins, no. Their genome is exactly the same. But what makes identical twins different from each other later in life are their life experiences and the environment that they grow up in. Now, every now and then during the developmental phases, sometimes based upon environment or whatever, some genes get turned on and turned off in there, and that can cause some some small differences there, but usually they would look identical. Okay, so that is the difference between identical versus fraternal twins. Okay, so going back here, so the secondary follicle has knocked out its competitors and it keeps on growing. Okay. So once again, as we've I've showed you earlier, primary, secondary, and the tertiary Graafian follicle. Okay. All right. Now at day 14, that's when you have a fully mature follicle, and that's called the tertiary Graafian follicle. This is the tertiary stage. Okay. The oocyte is now fully mature, and when it leaves the follicle, once again, it becomes an ovum. And when it pops out, it becomes an ovum. And then while in the follicle, the oocyte is surrounded by a ring called the corona radiata, which supplies the nutrition for the ovum while it travels down the fallopian tube toward the uterus. Okay, the egg cells that are inside the ovary, they are surrounded by blood vessels and capillaries and a lot of other pipeline to send nutrients there to keep them alive. So that's no problem, but that's while they're in the ovary. But as soon as they leave the ovary and they go traveling, tumbling down that fallopian tube, the fallopian tube is full of all the cilia and little whip-like structures to help push that egg cell down toward the uterus. There are no blood vessels nearby. Okay, and so the egg cell has to fend for itself. It's got to provide its own backpack of nutrients. That would be the corona radiata, so that as it's tumbling down, it can stay alive just a little bit longer to wait for a sperm cell to come by. And even when the sperm cell has fertilized that egg, give it enough energy and nutrients to make its way down to the uterus. Its destination has to be in the uterus, because while the lining in there is building up, there are blood vessels coming out. They're just waiting for that oocyte. They don't know where the oocyte's going to plant. But wherever it does decide to implant, there should be a blood vessel nearby. And as soon as it makes it there, then the blood vessels will start to connect with that zygote and start to supply it with more nutrition. Okay. All right, now it is surrounded by a space called the antrum, which contains a very clear fluid, and the antrum is surrounded by those follicular cells. So you can see here is that oocyte hasn't popped out yet. When it pops out, it's called the ovum. We have the corona radiata backpack of nutrition. We have the antrum, and then we have here the follicular cells on the outside. Okay. Here is histology slide of the Graafian tertiary follicle. You can see that the oocyte's right there on the inside. We've got the corona radiata backpack of food. We have the antrum here, and then the follicular cells on the outside. And just a little side note, I kind of totally not related to this, but this looks like a dragon's eye to me when I look at it. It looks pretty cool. Anyway, moving on. Okay, again, here's the ovary, another image of the tertiary Graafian follicle. You can see, it should be 2 A's here. You can see that we have the oocyte, we have the corona radiata, all the other structures that we've talked about. This one looks like an angry, shocked pumpkin. Anyway, whatever. 2 eyes, you can see 2 eyes and a mouth. Okay, whatever, move on. Okay, so again, here are some of the images of the primary, secondary versus tertiary follicle. I'm going to go ahead and give a nice zoom in, because here's an example of the primary follicle, secondary follicles here, and here are the tertiary follicles in that ovary. All right, let's talk about ovulation. Now, the mature follicle is still producing estrogen. It has become so big that it forms a blister on the outside of the ovary. The adenohypophysis secretes another hormone called the luteinizing hormone, and this causes fluid to rapidly flow into the antrum, which then expands and pops like a water balloon, which also breaks through the tunica albuginea. The egg and corona radiata are released into the peritoneal cavity, and the process is called ovulation and can cause some discomfort. Okay, I'm done with this image. You guys have seen this. You can pause the video and analyze it. I'm moving forward. Okay, now the follicle cells that are left over remain in the ovary and are called the corpus luteum. Okay, that's a leftover sac that's left behind. And like I said moments ago, it does have a function. It's just not garbage that's going to get thrown away. It does serve a really important function. And what it does, it secretes out progesterone to help thicken the uterus. Okay, while the ovum is tumbling down, waiting for a sperm cell and tumbling down toward the uterus itself needs to thicken up with blood vessels in order to supply the eventual zygote to implant in the uterus and then start to provide it nutrition. Okay. Now, after a pregnancy, the corpus luteum disintegrates into dead tissue and a white scar called the corpus albicans forms. In an autopsy, you can see how many of these scars are present to determine how many pregnancies that a lady has had. So, all right, there we go, corpus luteum and the corpus albicans, okay? Now the egg takes a week to make its way down to the entrance of the uterus. The follicular cells, or the corpus luteum, continue to grow, and now they make that progesterone, which builds that uterine lining to prepare for the egg to implant in the uterus. Now, at day 23, if no fertilization happens, the egg will have used up all of its nutrition in its corona radiata, right? And then it starves itself to death and it breaks down. It's just no longer going to survive. And then at day 28, the reproductive system picks it up that, shoot, there is no fertilization. Okay, so why are we pumping out the estrogen? Let's bring that estrogen down. And then the menstruation starts back and resets at day 1. The uterine lining begins to break down. It sloughs off and gets removed, and then therefore it resets one more time. Here are some websites that you can visit to learn more about ovulation and meiosis. Let's go ahead and talk about the ovarian reflex. A woman is only fertile when the egg is released out, but there is something, as I mentioned earlier in the lecture, called an ovarian reflex, which stimulates ovulation in response to sexual intercourse, but not necessarily with orgasm, okay? There is no safe time to have unprotected sex, because even during menstruation, the sperm can live in the female body up to 10 days, very hardy sperm cells. Now, here are 2 diagrams showing you the hormonal fluctuations of the luteinizing hormone and the follicle stimulating hormone. This is here the beginning. This is like day 1, and here's what, day 28. And the same thing here, day 1, day 28. Okay, you can see right midway at day around 14, the luteinizing hormone, the follicle stimulating hormone do peak, and then they eventually drop down. Okay. Same thing here at around day 14, when you have that secondary follicle, the estrogen level spikes up. And as soon as we have that corpus luteum, then the progesterone level spikes up in preparation for the implantation of the zygote. Here's another image kind of showing you here day 1 versus day 28 and what the one follicle would look like as it's going through the menstruation cycle. You can see right around day 14, the ovum is now leaving, and then what's left behind is a corpus luteum. Here's a primary follicle, secondary, and the tertiary Graafian follicle. In the uterus, there's also a lot of things going on here too. We have the development of the uterine lining. You can see all the blood vessels are coming up in preparation for that embedded zygote, okay? And it is split into 3 phases as written here, so. All right, let's talk about the hormone estrogen. In addition to the thickening of the uterine lining, the estrogen allows for the deposition of subcutaneous fat, which is what gives women their curves. Unlike progesterone, estrogen causes the female's secondary sexual characteristics to develop, for example, breast tissue, the curves, and pubic hair. In pregnancy, the breasts get larger, the mammary glands also get bigger because, again, the breast tissue has to develop the milk in order to feed the eventual offspring, baby. Now, the functional unit of the ovary is the follicle because it contains all the things that it can do to supply for the egg cell, to create that egg cell. So the ovary is a functional unit of the female reproductive system. And the ovary, yes, follicle for the ovary. Now, did you know, is it possible for a baby to have 5 parents? Well, you can have a sperm donor, egg donor, surrogate mother who ends up giving up the child to an adoptive mother who has an adoptive father. You could have 5 parents. If you think about it sociologically, you can. All right, let's talk about infertility. One of the most common causes of infertility in women is a sexually transmitted disease. There's another term that's used these days. It's called an STI, sexually transmitted infection, which is more politically correct these days. Also, fat needs to be present in order for women to have a regular menstruation cycle. Skinny and athletic women might not be able to menstruate because it is an energy-intensive process, although they still can get pregnant, okay? So let's talk about fertility pills. Women who have trouble conceiving can take fertility pills, and there is one brand called Lupron that does. So what it does, it significantly increases the concentration of follicle-stimulating hormone that's produced, and rather than having 20 to 30 eggs or follicles that start the race, now you have 100 of them, okay? I wish there was a way to go 40 to 60, 60, 80, 80 to 100, but no, we have here 100, okay? So rather than counting on 20 to 30, hopefully 100 would do it, but there is the risk. The risk here is that you might get multiple births, okay? Because 4 or 5 of them might get into a tie with each other, okay? Now, there is a urine dipstick that can determine when ovulation is occurring, and on that day, she's given a trigger injection of HCG, which stimulates the final steps of maturation of the eggs. Within 2 days, she goes back to the doctor, where they use ultrasound to see where the Graafian follicles are. Then they use a needle to aspirate them and take them out. And this is done by going up the vaginal canal with an endoscopic camera. The eggs are then fertilized in vitro and implanted directly in the uterus. Okay. Here are some YouTube videos that you can check out. Obviously, due to restrictions here, I'm not going to play that, but you can go on YouTube, open your browser, go onto YouTube and search for this, and it'll be there, should be there. All right, I'll let you guys pause this video and read this on your own. I'm going to go ahead and move forward. Okay, choosing the baby's sex. There are many different methods to choosing the baby's sex. I'm going to talk about 4 of them here. Now, once again, this is for academic purposes only. Okay, please consult with your healthcare provider for the appropriate one that's for you if this is something that you're looking into. Okay, but whatever we learn here is for academic purposes only. Okay. Okay, academic purposes only. All right, so here are the 4 strategies that I will talk about here. We've got the PGD, or pre-implantation genetic diagnosis, microsort, not Microsoft, the Erickson technique, and we have some at-home techniques that people are talking about. Let's talk about the first one, the pre-implantation genetic diagnoses here. Okay. The PGD method starts with in vitro fertilization. And what they do is that they take follicle stimulating hormone, and that causes mainly the eggs to start developing. So they'll take a high amount of this follicle stimulating hormone, and then they'll remove the eggs, just like we discussed moments ago, and then they'll fertilize them in vitro. Okay, like I said, in vitro. In vitro means outside or in a test tube. That's what I hear a lot of people say and describe it as. There's another one, this in vitro, shoot. There's another one called in vivo, which means within the living. Okay? Now, they do genetic tests after they fertilize these eggs to select an embryo that has a desired sex, so either male or female. And that test would cost roughly around $4,000, maybe more today. This I haven't checked on the prices yet. And then once they've picked the correct one, they'll implant the egg back directly into the uterus, and it'll take off from there. Selecting for sex by in vitro fertilization started in the late 1980s to select sex in couples who carried sex-linked diseases. For example, hemophiliac genes are a problem in boys, so therefore the couple might want to take advantage of this technique to choose for girls instead, so they don't have to, have a boy and then have the boy suffer from that. All right, another technique here, like I said, is microsort. Okay, this is a dye technique that attempts to segregate girl-producing sperm from boy-producing sperm. Okay, and sperm of the desired gender, gender should be sex, is inserted directly into the uterus, usually via artificial insemination. Okay, and the method here is 90% successful when it comes to choosing girls and 75% successful when it comes to choosing boys. Okay. Sex is a biological assignment. Gender is a sociological assignment, okay, or anthropological, sociological assignment. All right, third one here is the Erickson method, and this is a technique that aims to separate faster swimming boy-producing sperm from slower swimming girl-producing sperm. Now, normally I would ask this question in my class, and for those of you guys that are taking notes, and I require you to answer all of my questions, this is one of them, okay? Among many others I probably haven't even asked you guys or don't even point out. Why is it that boy-producing sperm swims faster than girl-producing sperm? And one of the reasons why is very simple. If you look, there are 23 chromosomes. Okay, there are 23 chromosomes, and the 23rd chromosome is the sex chromosome, and the sperm cell is either carrying an X or a Y. And you can see here, based on the picture I've drawn, the X chromosome is very large, the Y chromosome is very, very, very small. So the reason why male producing sperm or boy producing sperm swims faster is because there's less weight. That's it. Okay, it's just less weight to carry around. They have that tiny little Y, so therefore they can swim a little bit faster. So sperm of the desired sex, well, I mean, you could say gender if you want. I mean, in this case, it is, yeah, are inserted directly into the uterus via artificial insemination. The Erickson method claims 85% effectiveness when choosing boys and 75% effectiveness when choosing girls. Okay, now some at-home techniques. Once again, always consult with your healthcare provider before attempting any of these methods, okay? There is a Shettles method, and the theory here is that the sperm bearing the Y chromosome for boys moves faster, but don't live as long as the sperm that carries the X chromosomes. So if you want a boy, this method argues that you should have sex as close as possible to ovulation. If you want a girl, you should have sex 2 to 4 days before she ovulates, but you must figure out when she's ovulating. Also, the father might want to wear boxer shorts if they're trying for a boy. The sperm would need to be cooler because boy sperm are very sensitive, extremely sensitive. Even the slightest temperature change can make them go bananas, and they just won't survive as well as female producing sperm. Okay, female producing sperm are much more hardy and more resilient compared to male producing sperm. Okay, he should not wear tighter underwear when trying for a girl. It will decrease overall fertility. By how much, whether it's significant, yeah, you know, when it comes to couples who are really trying, any little bit helps, right? When trying for a girl, a man should take a hot bath right before intercourse, and that's what they say. Okay, well, anyway, a little cartoon. moving on. All right, there's also another method that says to adjust the pH of the vaginal canal. The closer to the entrance of the vagina, the more acidic the woman's tract is. And that makes sense because closer to the entrance would be closer to the outside of the world where there's a lot of bacteria, microbes, pathogens, a lot of other stuff out there. And you don't want these microbes to make their way into the vaginal canal and start colonizing in there, because microbes love dark, moist, and warm areas. Those are the three prime conditions for bacterial growth. Armpits are good for that. The genital region is good for that, and also, just like the vagina. Men, we have the same thing. Okay, although not as well. Anyway, so that the acidity near the vaginal opening would make sense. So any sort of bacteria cell that lands itself there and is trying to find a residence, it will kill it off. Okay, that's good. Okay, now the sperm that makes boys cannot tolerate the pH as well as a girl producing sperm. Like I said, boy producing sperm are very sensitive, extremely sensitive. Okay. A douche of water and vinegar or acid immediately before intercourse to favor a girl, or a douche of water and baking soda alkaline will help favor a boy, because alkaline baking soda will help to neutralize the acidity of the female tract, allowing the male producing sperm to have a better chance of survival. Some say that calcium magnesium supplements also make the vagina more alkaline, so something to look into. There's also different positions that people talk about. For example, the boy making sperm needs to avoid the acidity of the female reproductive, of the opening, the vagina. So shallow penetration, the missionary position, will favor girls, and deeper penetration, rear entry of the vagina, doggy style, will favor boys, at least what they say. Note that some women are naturally very acidic and have a hard time conceiving boys. So that could be a reason. You can visit this link on your own time. All right, some complications of pregnancy here. It is the second most dangerous thing a woman can do to herself. The first is to get into a car without a seatbelt. Oh, it says so down here. 5 in a million die from birth control pills, abbreviated from this moment on as BCP. 100 in a million die from pregnancy complications. And again, number one here is getting into a car without a seatbelt. All right, combination birth control pills are made of estrogen and progesterone, and they're 99% effective. They're also used for easing hot flashes, during menopause, and restoring regular periods in younger women. So during menopause, the estrogen levels drop significantly, and that kind of starts to cause the menstruation cycle to not do its normal thing. And so one of the ways to kind of treat that is to put the estrogen back in there through an injection or supplementation or something, okay? However, they should be avoided by smokers and those 35 years old, because estrogen may cause dangerous blood clots. So here's another question to add to your notes. What is the danger of having high amounts of estrogen in the body? Okay, and the danger here is blood clots. Okay, blood clots. They can also trigger migraines in people who get migraines. Okay, so birth control pills are made of estrogen, so they inhibit the development of the follicles, but the uterine lining continues to grow. And they are typically taken for 3 weeks and then 1 week off to allow for a regular menstruation. Some of the new estrogen pills can cause a period only every 3 months instead, but there are side effects. Once again, blood clots is a side effect of high estrogen. There's another one here called the progesterone-only pill, aka the mini pill. You probably heard of this. Since these don't contain estrogen, they are safer for smokers, diabetics, and heart disease patients, and others who are at risk of blood clots. But you should not use these if you have trouble remembering to take the pill at the same time every day. They need to be taken at the same time every day. Otherwise, if you're more than 3 hours late, you have to restart it again. It doesn't work. All right, the extended cycle pill. This allows you to have a period only every 3 months. Note that Librol stops your period for a year, but you must take it every single day. Okay, and who should avoid it? Again, there's no evidence proving it's dangerous not to have periods, but again, blood clots due to high estrogen levels can be dangerous. There's also a birth control patch. You can place a hormone releasing patch on your arm, your buttocks, your abdomen, and rest easy for 1 week. Now, who should avoid it? If you're particularly at risk for blood clots, you might want to find a different method. The patch delivers 60% more estrogen than a low-dose pill, so you're at an increased risk for dangerous blood clots, okay? Blood clots is the big one here. High estrogen, excessive amounts of estrogen in the system can lead to blood clots. Now, another method here, let me see if I can move my, there we go, maybe that'll be good. All right, another method here is the implant, okay? This implant is about the size of a matchstick, and the implant is placed under the skin on your upper arm, and it can last for 3 years, but can cost upwards of $800. Okay, so 800 divided by 3, it's like 260, 70, I don't remember, 200 and something dollars a year. They are nearly 100% effective. However, they may not work well for women who are taking the St. John's wort, which is a herb for depression, or women who are overweight. Again, the matchstick, this implant here, contains a set amount or set concentration of a particular compound, okay? And that particular concentration is effective for women who are within a weight range. But if for obese, then of course, they would need to have a higher concentration for that. And one would probably not work. They need to have some other concentration. That the physician will be able to determine if this is the right option for that person. All right, the next one here is the morning after pill. Okay, now the morning after birth control or emergency contraception is available without prescription and is sold under Previn or Plan B. Okay, and this method involves a woman taking a higher than usual dose of the same hormones used in birth control pills within 72 hours, earlier the better, 24 hours ideally, of unprotected sex, and it is often used in cases of rape and is offered at the emergency room. And how does this work? It greatly reduces the chance of pregnancy by preventing implantation. That's the key. It prevents implantation of any fertilized egg. You should not, however, be relying on the morning after pill birth control as your regular form of contraception. It can cause side effects, and the high doses of hormones should not be taken regularly. It is also not as effective as other forms of birth control and does not protect against sexually transmitted diseases in any way. All right, now before planning contraception, the female should stop taking birth control pills 6 to 12 months beforehand. Unprotected sex twice a week for a year increases the chance of pregnancy to 90%. Okay, if that doesn't work, very likely fertility problems. Birth control pills are 99% effective if you take them at the same time every day, but then so are condoms if they're used correctly. And so the way to use them is you should be squeezing out the air at the tip, and only use water-based lubricants for latex, not silicone-based, because that will tear it. No lotions or baby oil, that will tear it, because lotions and baby oil tend to be hydrophobic, and just like Vaseline. So those are not good for latex. You want to use something that is water-based. If not only 85% effective, the solution here, they say, is to put the woman in charge of the condom, and the failure rate drops dramatically. Once again, the proper way to put this on, again, no hand lotion, Vaseline, baby oil, or anything that is hydrophobic, anything that's thick in texture, not silicone-based. You really want, unless the manufacturer says it's okay, but you want to avoid those water-based, okay? And you want to squeeze the air out, because what happens is that if the ejaculate gets shot into this chamber, then the air will recoil back, will create an opposite force, and it will shoot out the opposite end, and that's no good. That can lead to pregnancy. So you don't want that. You want there to be a vacuum. So you don't want any air here, a vacuum, so that any ejaculate that gets thrown in there, it stays in there, okay? All right, another one here is a vaginal ring, and this ring is made of flexible plastic and delivers estrogen and progesterone, just like the combination pill. And you place the ring in the vagina for 3 weeks, and then remove it for 1 week so that the regular menstruation period can happen. Okay, this is called the diaphragm. Okay, and this is made of rubber and shaped like a dome, and a diaphragm prevents sperm from fertilizing an egg. It covers the cervix and must always be used with the spermicide, because you never know. Women must be fitted for a diaphragm at their doctor's office, and who should avoid it? Well, if your weight fluctuates by more than 10 pounds, you'll need to be refitted. These are prone to bladder injections. If a person is prone to bladder infections because of this, they might want to consider an alternate option. Okay, the intrauterine device here, this is a surgically implant copper device that prevents sperm from reaching the egg cells. Some also release hormones. Intrauterine devices are more than 99% effective and good for up to 10 years. Now, who should avoid it? Well, some doctors recommend the device only for women who have given birth. When the device is implanted, your uterus is expanded, and this might cause pain in women who have not had children yet. If you're planning on having children in a year or two, you might want to look at other options. All right, of course, the female condom is an option here. It also offers some protection against sexually transmitted diseases, and it is inserted deep into the vagina over the cervix, much like a diaphragm, but unlike the male condom, the female one can be put into place up to 8 hours before sexual intercourse. Okay, tubal ligation. Okay, this is similar, or the male equivalent is a vasectomy. Okay, the male equivalent is called the vasectomy. Tubal ligation is a method of birth control where a piece of the fallopian tube is cut out, and there's no way for the sperm cell to reach the egg. It is more complicated than a vasectomy and involves cutting into the abdominal cavity, so it's like a full-out surgery. So it is done less often than a vasectomy. And again, only 1 in a million is not successful. Okay, here's another one called E-Sure, not Ensure, E-Sure, okay? Now, E-Sure is a non-surgical procedure for women that involves placing small coils into the fallopian tube. And as you can see, here are the coils. Okay, this is what it looks like. In 6 months, scar tissue starts to build and develop on top of these coils, and it completely blocks out that fallopian tube and prevents conception. So if we look in here very closely, you can see that the coil here, the tissue starts growing on top of the coil because the coil's not coming out. It's stuck there. And if it's stuck there, it causes a lot of friction and wearing and tearing in here. And when it tears, the body's going to want to repair itself and heal, but it's going to heal over the coil. When it heals over the coil, it completely locks that tube shut. Okay, so sperm cells can't reach it. Egg cells can't come out. Sperm cells can't reach it. Okay, the least effective method of birth control. The least effective method is the penile withdrawal method, or withdrawing the penis right before he ejaculates. Statistics say that there is a 30% chance of pregnancy with this method. And besides, you never know. Okay, guys never know, or of course they know, but sometimes they forget, or sometimes they don't. It just happened as oh shoot. Okay, so you don't want to count on the guy to withdraw unless he has excellent discipline. But for the most part, you don't want to count on that. You want to take safety precautions, or do it safe. Don't rely on this, okay? So, okay, let's move on to the next structure. Okay, we'll talk about the fallopian tubes. Now the ovum is, so after the oocyte completely gets flushed out of the Graafian follicle that we discussed earlier, okay, it's flushed out of that Graafian follicle. Now it becomes an ovum. And as soon as it goes into the peritoneal cavity, and now it gets suctioned into the fallopian tube, okay? The uterine tube, or fallopian tube, has these finger-like structures called fimbriae. So as I say, here's the ovary, and here is the fimbriae, and here's that fallopian tube that I drew earlier. These are the fimbriae, okay? Or fingers that surround the ovary, and when the egg is released, it goes into the peritoneal cavity, but the cilia that line the uterine tube will create a suctioning current that eventually lifts and pulls the egg into the fallopian tube. Okay. Here it is. There is that fimbriae that I've discussed earlier. Okay. And this whole piece is, of course, the fallopian tube. Now, the fallopian tubes obviously need to be anchored down somewhere so they don't start going all over the place. They are held by a broad ligament and a suspensory ligament. And the uterine tube is around 10 centimeters long, or 3 inches, but only 7/10 of a centimeter in diameter, and the actual lumen where the tube enters uterus is actually very tiny. Okay, again, here is that fallopian tube. If you look here on the inside, we've got 3 regions of the fallopian tube. The one nearest the ovary is called the infundibulum. Okay, the next region here is ampulla, and then the last portion here is the isthmus. Okay, and that makes up the fallopian tube. All right, like I said, we have the infundibulum, which stands for funnel, this piece. And then we have the ampulla, which is the middle portion. And then we have the isthmus, which is the closest one to the uterus. And guess what? The ampulla is where fertilization takes place, right here in that mid-tube. Fertilization does not take place in the ovary. Okay, I really want to emphasize that. Fertilization is not in the ovary. My goodness, I get this all the time, every semester. People keep thinking, oh, if the egg cells are made in the ovary, that's probably where fertilization takes place. No, no, no. It happens right here in the fallopian tube. Okay? If fertilization did happen, and apparently half the population thinks that this happens, fertilization takes place in the ovary. It does not take place in the ovary. And if you can imagine, if fertilization even did take place in the ovary, we'd have a lot of angry women out there, because all the egg cells would be fertilized in one shot. And that's unacceptable. And then so definitely in the fallopian tube, all the other egg cells that are sitting in the ovary are going to wait for their turn when the next cycle comes around, but they're not all going to happen at once. Okay, that would be pretty bad, right? A lot of angry women would be out there. So, okay, let's talk about ectopic pregnancy. The egg is normally fertilized in the uterine tube, and it goes down into the uterus and then eventually burrows and implants itself there. Any other place other than the uterus, that's called an ectopic pregnancy. Okay, if it implants in the uterine tube, it's called a tubal ectopic pregnancy, or just tubal pregnancy for short. The uterine tube is the most common location for the ectopic pregnancy. So right here, sometimes the egg cell is still making its way down to the uterus, but it doesn't make its way in time enough, so it burrows right there in the fallopian tube. Sometimes they get lucky. Sometimes it happens. Ectopic pregnancies are almost always fatal to the mother and embryo, but nowadays we do have a good technology to help take care of that so that the mother and the baby can both survive. It is very painful though, okay, very painful. Now, a woman who goes into the ER with abdominal pain will always get a pregnancy test. The egg can also implant into the wall of the peritoneal cavity, which is also usually fatal. There was a mother whose embryo implanted on her liver, and at 6 months, it was delivered by C-section, but both mom and baby survived. Again, with our advanced medical technology, it's not much of, it is a concern, but it's not life, or it is life and death, but because with the technology, it doesn't have to be, okay? Okay, you can read about this story, 46-year pregnancy. I'm going to go ahead and move forward. I'm going to move forward too. Yep, moving forward. Okay, let's talk about the stone baby. In an ectopic pregnancy, if the dead fetus is too large to be reabsorbed by the mother's body, it becomes a foreign body to the mother's immune system. The mother's body will encase the fetus in calcium deposits, and the tissues will die and dehydrate. Now, as the calcium wall builds up, the fetus is gradually mummified, becoming a lithopedion, or stone baby. Litho means stone. Ped means child, okay? Or baby. Here's an example of a 46-year-old stone baby. Okay, this is a baby. And what happens is that the mother's defense immune system picked it up as being foreign and started depositing calcium all in it. And they decided, well, the baby's not alive anymore, so let's take a look inside. So this is what they found inside. Okay, you can watch these. Actually, go on YouTube and search for these if you wish. Okay. All right. PID, or pelvic inflammatory disease, well, sperm swimming out of the opening of the uterine tube and into the peritoneal cavity. That means any STD can also enter there, causing pelvic inflammatory disease, which is when it spreads to the ovaries. Okay, it could then continue to all the organs in the pelvis, except those organs which are retroperitoneal, so the kidneys, the ureter, and the urethra. Now, inflammation of the fallopian tube or the uterine tube, the technical medical term for that is salpingitis. Okay, salpingo means fallopian tube or uterine tube. Itis here means inflammation. Okay. Now, a woman's peritoneal cavity is open to the external world, and that's why the lumen of the uterine tube at the isthmus has to be so narrow. The cervix also has mucus for protection, and the vagina, of course, we know, is very acidic. Now, the most common cause of PID and infertility in women is an STD, usually chlamydia or gonorrhea. The inflammation and scarring closes off the uterine tube. Although PID does not inhibit ovulation, it can lead to sterility. And sterility means that they can no longer have children. It causes extreme pain for 1 week every month for the rest of their lives, and there is no cure. And it occurs most often to teens and women in their 20s. Okay, the next structures here. We've got the uterus. Okay, that's our next one. And the uterus has several regions. There's the fundus, the body, the cervix, cervical canal, and the vaginal canal, aka for short, vagina. Okay. All right, so here we have the uterus. Okay, there is the vaginal canal. And the vagina, we'll learn later, has rugae, which are folds within the canal. Okay, these are called rugae. Okay, these folds. And it allows for stretching to accommodate the baby that's going to pass through the vagina. The vaginal canal is the technical term, but when we're talking about it in terms of the birthing process, they call it the birth canal. And hospitals would prefer to use the word birth canal in front of their patients. Now, with each other in the break room or something, they don't mind saying the word vaginal canal, but when they're in front of patients, usually they say the birth canal because it's much more rated G. Okay, much more calm, much more acceptable, pleasing to the ear versus vaginal canal or even vagina. Okay. We have here the cervix, and this whole piece here is the uterus. And here's the body of the uterus. The fundus is this upper portion here. And then we have the different layers of the uterus here. We have the endometrium, which contains the stratum functionale and the stratum bacilli. We also have the myometrium, the muscle portion here, which will contract in response to oxytocin, which we'll talk about later. And then we have the outer portion, which is the perimetrium. Okay, you want to note here that when you're referring to a structure that has a cavity, like the stomach, esophagus, uterus, and the eye, the layer that touches the lumen is considered the superficial layer, even though from the outside of the body it would be considered deeper. Therefore, the endometrium is superficial, okay, to the myometrium. Now, when a woman stands upright, the uterus sits on top of the urinary bladder. You can see here just physically, the uterus is tilted over and it's sitting right there on top of the bladder. So what prevents it from completely leaning onto the bladder is the round ligament and the broad ligaments to hold it up, okay? If the ligaments start weakening, the weight of the uterus could press down on the bladder, causing more frequent urination. Okay, so once again, you can see here is the round ligament and the broad ligaments that help to keep the to help with the uterus. Okay. All right, the layers of the uterus here. We've got two layers of the endometrium. Okay, we've got the stratum bacilli, which is the deepest layer, a deeper layer that can divide and grow to replace itself. And then we have the stratum functionale, which is the layer that sloughs off during menses. It thickens up and undergoes the changes during menses, and it has a lot of uterine glands and blood vessels there. And you can see here is the uterine wall. The lumen is up here, and you can see we have the upper regions, okay? The different layers here. All right. Now, the stratum functionale develops with the hormonal cycle, which causes it to grow along with its glands and blood vessels. And when the estrogen stops, the stratum functionale begins to break down and it sloughs off, leaving behind the stratum bacilli. Now, deep to the endometrium is the myometrium. This is the muscle itself. That's what myo stands for. And that contains smooth muscles that contract during childbirth. And then the outermost layer here is a perimetrium or the epimetrium, and that is the name of the visceral peritoneum. Okay. We've already seen this, so I'm going to go ahead and move forward. Okay, so here's a weird ER story that an elderly woman from a nursing home was brought in and complained of a large ball between her legs. It was her uterus, which had come out of her vagina. When one gets older, everything starts to sag, and in some cases it hangs out, including the uterus and the rectum. A rectal prolapse is fairly common in both older men and women and generally comes from weakened ligaments and years of strained bowel movements. So eat fiber and drink lots of water. Now the next slide here will show you that. Here is what a prolapsed uterus will look like. The torn ligaments can decrease the support of the uterus, which can then prolapse and fall out through the vagina. And then we can see here, here's the prolapsed uterus. That's a uterus that has fallen out, okay? All right, now endometriosis here. Pieces of the endometrium are supposed to fall down the vagina, but sometimes the cells go up the uterine tube and enter the peritoneal cavity. They can lodge anywhere on top of the fundus or even in the lung pleura. Now, these cells still respond to hormonal changes. They grow and break down and die, causing pain during menstruation. It's difficult to diagnose because the pain goes away before the doctor's appointment. The symptoms vary depending on the location. And there was one lady that got a collapsed lung every month. And the treatment here is to give hormone to prevent menstruation. You can see here the endometriosis tissue on top of the uterus. Okay. Here's another one. Here's another one. All right. Now, a polyp here is a general term that describes any mass of tissue with which bulges or projects outward or upward from the normal surface level. A uterine polyp is an outgrowth of the uterine lining, and they may occur if the uterine tissue is not completely sloughed off each month. The procedure to scrape them off is called dilation and curettage, or D&C. Now, fibroids are benign, smooth muscle growths that arise from the uterine muscle, and fibroids can be found inside the uterine cavity, the submucosal layer, within the uterine muscle, intramural, and on the outer surface of the uterus, which is the subserosal. Fibroids grow in response to estrogen, and up to 1/3 of all reproductive age women will have at least one fibroid in their uterus. Now, these are benign tumors like scar tissue, and they can get large and be painful, especially during contraction of menses and pregnancy. Fibroids are the most common reason for a hysterectomy. Okay, hystero means uterus. Okay, ectomy means surgically remove. Here are some examples of those fibroids here. Okay, another one, and this is them removing it. You can see here the fibroids down here. They're using a sort of heat, not heat, but it's like a electrical current through this to not zap, but to kind of cotter it off. Okay. All right, dermoid cysts here. This is a group of skin cells that got inside the body, developed there, and were walled off, forming a cyst. That's your body's, one of the body's way to section off things that's not supposed to be there is to form a cyst. Now, these contain developmentally mature skin, complete with hair follicles and sweat glands, sometimes clumps of long hair, nails, teeth, and even eyeballs. They are almost always benign. So here's an example of one. You can see teeth, hair, some spongy tissue also here. Okay. Another one here, some tumors that you can pause and look at. Another one. Other dermoid cysts here. What was inside? You can see hair, Oh my gosh, that looks like an eyeball. Some more hair here. Yeah, that looks, yeah, I don't know. That looks pretty nasty. So, okay. Ultrasound videos, you can look on YouTube. All right, what is a hysterectomy? Well, it comes from the Greek hysteria, and it was thought that only women get hysterical because they had a uterus, or have a uterus, I'm sorry. Now we know that's not true. They get hysterical because they have ovaries. The surgery involves going through the abdominal wall, cutting the broad ligament and uterine tubes, and yanking the uterus out through the vagina. That's hysterectomy. Now, a retroflexed uterus. Okay. As a woman matures, a uterus may not move into a forward position. That usually does not cause fertility problems, but childbirth can tip the uterus forward or backward. If the ligaments holding the uterus in place stretch or lose their tension during pregnancy, uterus can become tipped over. In most cases, the uterus will return back into its forward position after childbirth. Now, scarring from adhesions as a result of endometriosis or fibroids can also cause the uterus to shift to a tilted or retroflexed state. An uplift surgery can be performed to reposition the uterus, and this typically reduces the pain experienced during intercourse or menstruation. All right, the vagina is next. The function of the vagina here is to receive the male penis and sperm cells. It's about 9.5 centimeters or 3.75 inches long in the unaroused state. It is lined by mucosa made of non-keratinized stratified squamous epithelial cells. Therefore, its function is to protect against abrasions. Now, below the mucosa is a lamina propria with some glands. Most secretions are from the uterus here and has a lot of elastic fibers since it has to stretch during the birthing process. Once again, those structures that I mentioned way at the beginning of the lecture are called rugae. Okay. I think I've had enough of this image. We've seen this enough. Again, this is a lateral view. As you can see here, the urinary bladder, this is the urethra is here, and then the vagina comes next, the vaginal canal. Now, there is a muscularis layer around it, like the intestines, which allows for peristalsis of the vagina during orgasm, which helps sperm cells move into the uterus. And peristalsis also helps during menses. Now, surrounding that is the adventitia layer, which is made of dense connective tissue with elastic fibers, and this attaches the vagina to the surrounding structures. All right, for anyone here who was wondering about the G spot, okay. Now, the hymen. Now, in a virgin, at the vaginal opening, the tissue extends into the vaginal orifice, and that's called the hymen. If the hymen covers the whole opening, the menstrual flow cannot get out, and so they'll need surgery to remove it. Some women are born with a small hymen, so there's not much bleeding at the first intercourse, but some have a hymen so thick that they need surgery in order to break it open, okay, before penetration. Here's an example of a hymen. You can see some tissue that's there. If I zoom in a little bit. Okay, you can see the tissue is obstructing the passageway. Okay, and different hymens as well. Here, as you can see, there's a normal hymen. Here's a very large hymen completely almost obstructing the passageway. And of course, a small hymen here above. All right, let's talk about the external genitalia or the vulva. Okay, all the structures, reproductive structures that are found outside are collectively known as the vulva, collectively, okay? So parts of the vulva here include the pons and the mons pubis, which is a pad of adipose tissue above the pubic symphysis that is covered with pubic hair. We have the labia majora and the labia minora. The labia majora is an extension on either side of the vestibule, and it also contains pubic hair. It is the female equivalent of the male scrotum. And actually, the reason why they say this is because there was a couple of biologists, what they did was they fluoresced these structures while in embryo, okay, in the uterus, in embryo, and they followed the development of these cells for both males and females, and they found that the structures that fluoresced were the labia majora, and compare that to the males would be the scrotum. So those two fluoresced. Okay, so they knew that those cells were part of the same line. You also have here the labia minora, which is medial to the labia majora, and they are thin folds of mucosal tissue. We also have here the clitoris, which is equivalent to the male penis, okay? And actually, they did the same thing. They fluoresced these cells while the embryo was developing, and they found that what became the clitoris became the male penis, okay? So they were able to follow those. And the clitoris does contain erectile tissue, much like the male penis does, and that is called the corpora cavernosa, and that fills up with blood in order to cause an erection there. The clitoris is also covered by a prepuce or a foreskin, just like the male penis is also covered by a prepuce or a foreskin. Okay, so once again, here's the mons pubis. We have here the prepuce of the clitoris or the foreskin. We have here the clitoris. We have the vestibule, which is this whole piece, and the labia majora and the labia minora on the outer and the inner. Okay. All right. Now, the vestibule here is an area bounded by the labia minora, which contains the urethral orifice, the vaginal orifice, and the vestibular glands, which secretes mucus during sexual arousal for lubrication. Okay. Oops. Oh, by the way, I want to point out here that the anal canal is more posterior, obviously, right? And so they say that for women, after defecation, which is to wipe from anterior to posterior, not posterior back out to the anterior. Because the risk here is that if wiping from back to front, you risk the E. coli cells going into the vaginal canal or the urinary meatus here, the urethral orifice, I'm sorry, yeah, the same thing, urethral orifice, and it can cause an infection. Okay. All right. I've already just talked about that moments ago. This is kind of, you can see here the vaginal orifice and the vestibular glands here are nearby. Okay, let's talk about childbirth. Now, during childbirth, the vaginal orifice begins to enlarge, so it will either stretch or tear at the posterior position. If it tears, the vagina and the anus can be connected by that tear, causing a serious infection. Okay, the surgeon can do an angled cut away from the anus through the muscles of the pelvic floor, and that's called an episiotomy. So right here, as you can see, this here is the vaginal canal. Here is the anus. And what happens if the baby is coming out and the skin here is weak, it might tear, and that tear might break its way into the anus, and the E. coli cells will eventually travel there, and that's no good. Okay, so what the physician will do, they'll make an incision or cut off to the side. So if it is going to cut, it'll cut away from the anus, not toward the anus. Now, again, the purpose of the episiotomy here is to minimize tearing of the central tendon and the muscles of the pelvic floor. Now, even if there was no tearing during childbirth, afterwards there can be weak muscles, so the external urethral sphincter can become incompetent, so can the external anal sphincter. So the treatment prevention here is exercises for the muscles there and the external urethral sphincter. All right, let's talk about the mammary glands. Okay, this includes the breast tissue, and these are modified apocrine glands, and the breast may become tender at ovulation from the effects of progesterone. As a uterine lining is swelling, the body also retains water elsewhere, including the breast tissue. Caffeine intake makes it worse. Now, milk glands are underdeveloped in non-pregnant women, and the milk production begins right at the start of childbirth, or just before childbirth. Okay, different reproductive system cancers for women here. Breast cancer, number 1. We have ovarian cancer, which arises from cells in the germinal epithelium. We have the endometrial cancer, which arises from the endometrium of the uterus. Cervical cancer here, which is slow growing and arises from the epithelium at the tip of the cervix. Oh, by the way, for those of you guys who didn't know, here is the cervix. Oops. Okay. You can see here's a diagram showing the breast tissue here. You can see we have, of course, the nipple, and the tissue around it is called the areola. We have here the suspensory ligaments, and then you have all the milk ducts. okay? Now, in breast cancer, the cancer cells usually originate from the milk ducts, as I mentioned. When the breast gets cancer, the skin of the breast dimple because the suspensory ligaments of the breast are involved. Now, again, breast cancer is the second most common cause of cancer deaths in women. 97% occurs in women over the age of 50. Treatment here is to remove the breast tissue. Either remove a lump from the breast tissue, which is called a lumpectomy, or you remove one whole breast, which is a mastectomy. If you remove both of them, it's called a double mastectomy. Okay. There's also radiation therapy, chemotherapy, and also the administration of select hormones. And the follow-up after this would be a halo breast pap test, which they test nipple aspiration fluid for breast cancer tissue, breast cancer cells. Also, this is also used for screening for breast cancer risk. Insurance doesn't cover, but it only costs $100, roughly, at least at the time I'm lecturing this. It might have gone up by now. Okay, the Halo Breast Pap test here. Your nurse will help you properly position the suction and collection cups over the breast tissue. The nipple will aspirate fluid, and if any is produced, they will be collected at the bottom of the cup. During the test, you will be holding the cups onto your breast skin, and the halo equipment will begin creating suction on your breast, and you'll feel mild warmth and gentle massage from the petals around the collection cups on your breast skin, and this increases circulation to the nipples and underlying milk ducts. Here's just a funny cartoon. All right, let's move forward. Let's talk about puberty. Okay, now puberty is a period of life that occurs between the ages of 10 to 15 in women. The reproductive organs begin to grow into their adult mature size. And the events of puberty occur in the same sequence in all individuals. The age at which events of puberty occur varies widely, again, between 10 to 15, sometimes even a little earlier than that, depends on the person. Now, when a female has her first menstruation cycle, that's called menarche. Okay, the last one, here's what's the first one? Write this down in your notes if I ask a question. What is the name of the first menstruation cycle? What's the name of the last menstruation cycle? The last one is called menopause. Okay, and menarche occurs about 3 years after the breast tissue begins to develop. Now, female secondary sexual characteristics here, which are induced by estrogen and not progesterone, that includes the budding of the breast tissue at around age 11, increase in subcutaneous fat, the widening and lengthening of pelvic bone, the appearance of axillary and pubic hair, and also estrogen-induced growth spurt from the ages of 12 to 17. Now, precocious puberty here is the onset of puberty before the age of 8, because at that point it's a little too young, okay? Girls who are obese have an 80% chance of undergoing precocious puberty, and it puts girls at a higher risk of sexual abuse, and the growth plates close around 4 years after menses start, so they become typically short in stature. The treatment here involves suppressing the follicle-stimulating hormone and luteinizing hormone, like pretty much tell them, hey, don't produce yet, wait until a little later. You can read up about Lena Medina. You can pause and read. I'm just going to go ahead and move on to the reproductive phases. Now, the female reproductive peak is in the late 20s, okay? And around age 35, the rate of follicle degeneration begins to increase. Ovulation and menstruation cease around age 46 to 54, give or take. Again, these are not definite. It depends on the person, depends on the genetics too. The ovaries will begin to stop secreting estrogen. And the reproductive organs and the breast tissue begin to atrophy because, again, you don't have the hormones to support that. You can pause and read. I'm going to move on. Okay, you can read and move on. Let's talk about some modern myths. The suggestion that douching immediately following intercourse works as a contraception is totally untrue. So the idea here is that any sperm cells that are inside the female reproductive tract, wash them out with a douche. That makes it actually worse because that can actually push the semen further inward toward the uterus. Having sex in a hot tub does not prevent pregnancy. It may actually contribute to vaginal infections because, again, it's a liquid. at this point. So you've got E. coli cells that are nearby, and they're going to swim out through the water and then go right in it. So that's not a good idea. Okay. Although some sexual positions may encourage pregnancy, no sexual positions prevent pregnancy. Having sex while standing up or with the woman on top will not keep the sperm from entering the uterus. The force of the ejaculation and the ability of the sperm cells to swim overrides gravity here, and especially peristalsis of the vaginal canal that we've talked about earlier in lecture. Okay. Sneezing or urinating after sex are also completely ineffective. Sneezing clears out your nose. Urinating clears out the urethra, but it has nothing to do with the vaginal canal. Okay. They do not prevent pregnancy and are not forms of birth control pills. I have no clue where the idea people thought that urinating after sex would do that, especially when the urethral orifice is not inside the vaginal canal. It's completely offset from that. I don't know. It's just, that boggles my mind. Okay, another cartoon that you can read. Move forward. Another one. Forward. Okay, we're gonna move forward here. Continue to move forward. All right. Now the rest of these PowerPoint slides are for coastline, so I'm gonna go ahead and lecture on these anyway. Okay, embryology. Now this is the study. This is the study of the origin and development of a single individual. And this is an amazing process that one cell can grow into an entire organism, entire person, entire being in 9 months. And at the moment of conception, you spent around half an hour as a single egg. Okay, the other half is the sperm. So as you can see here, fertilization happens in the ampulla of the fallopian tube, not in the ovaries. And again, as you can see here, the most common site of ectopic pregnancy is inside that uterine tube. Now, here is the first stage. Right as soon as the sperm and the egg meet and they fertilize, we get a zygote. That is the technical term for a fertilized egg. Then it starts to divide. We get 2, then 4, and then we get to like a 32-64 cell state, which is called the morula. And then eventually becomes a blastocyst, where all the cells inside of this mass will migrate toward the outer edges of that embryo and creates a hollow cavity inside called the blastocyst. Okay, this is just the way it divides, the way it develops. Okay, eventually these cells will multiply, divide, they'll start to invaginate inward, forming a digestive tract, and then we'll get a full-out embryo. Okay. Let's talk about the HCG hormone. The blastocyst is a stage that embeds into the uterus. It is like a hollow ball with cells on the outside and different cells on the inside. The trophoblast is the name of the outer layer of the cells of the blastocyst. And this is the layer that embeds into the uterus and will become the placenta. The trophoblast cells secrete out human chorionic gonadotropin, or HCG, which is a hormone that maintains the growth of the uterine lining, in addition to progesterone. Okay. If no HCG is present, there will be menses and a spontaneous abortion will occur. This is a hormone which is measured in a pregnancy test. It will be in sufficient quantities to be measured within about a week after a missed period. Now, chorionic villi here are projections from the fetus that burrow into the uterus. The capillaries within a chorionic villus of the placenta contain blood from the fetus only, not the mother. Therefore, the tissue can be used for genetic testing for birth defects. You can see here's the a blastocele, a blastula, and then it becomes and then it becomes here, this particular structure, and then it starts to burrow inside. And then eventually it will make its way in and begins the growing process of that embryo. Now, the heart starts to pump at around day 28, which is the end of the 4th week. The male and female fetuses can be distinguished apart by their genitals at around 3 months, the end of the 1st trimester. Here's baby at 13 weeks, baby at 3 months, baby at 6 months. Okay. Now, some birth defects can happen. We have fetal alcohol syndrome, which is from the mother drinking alcohol, which is the most common cause of mental retardation in babies in the United States. The most common birth defects worldwide involve the heart and circulation. And you can see here some of the signs of fetal alcohol syndrome. You can see here that the eyes are more farther apart. We have here a smaller cranium. We've got a low nasal bridge, small eye openings, a shorter nose, flat mid-face, thin upper lip, and underdeveloped jaw are some of the signs of fetal alcohol syndrome. Okay, you probably heard of the word a teratogen, which is a monster maker, and that is any chemical, physical, or biological agent that induces birth defects. This is an old term, very old term, used way back in the early 1900s or even earlier than that. Terato means monster, okay, because they used to call them monsters. Obviously, today we don't call them monsters. That would be socially unacceptable, but that is where the term originated from, way back in the olden days, okay? Thalidomide here is one example of a teratogen. This was a medicine used for morning sickness in the late 1950s and the early 1960s until it was found to cause babies to be born without arms and legs. 20,000 of these babies in 46 countries were affected because of this teratogen. And here are some images of those. You can see no arms and, okay, due to the teratogen. Here's another one. Happy baby. President Kennedy signs a law to prohibit that. Okay, I recommend visiting this link here. All right, fun facts. Be glad that you're not an octopus. They die after laying their eggs and after mating. However, if you remove an octopus's reproductive organs, they can live for a very long time. Octopi are very dedicated. Once the female has laid all of her eggs in a cave, for example, she will protect those eggs until they hatch. And usually by the time that they do hatch, the female has completely depleted all of her reserves in her body and pretty much dies off because she has no more energy left to survive for herself. All right. Every human spent around half an hour as a single egg. A fetus acquires fingerprints at the age of 3 months. If we could breed like a rabbit, we could produce 6 babies a month. The mammal with the largest number of births is the Tasmanian devil, which gives birth to 50 tiny babies at a time. The largest egg layer is a kiwi, whose egg is 25% of the total weight. That would be like a human giving birth to a 30-pound baby. The Proxidal frog tadpole is 5 times larger than its parents. And a giraffe gives birth standing up, so the baby has a 5-foot drop to the ground. That stimulates breathing and helps the placenta detach. Some fun slides here. Should you have a baby after 35? No, 35 children's enough. I'm 2 months pregnant now. When will my baby move? Well, with any luck, right after he or she finishes college. What is the most reliable method to determine a baby's sex? Well, childbirth. My wife is 5 months pregnant and so moody that sometimes she's borderline irrational. So what's your question? What is the best time to get an epidural? Right after you find out you're pregnant. Is there any reason I have to be in the delivery room while my wife is in labor? Not unless the word alimony means anything to you. Is there anything I should avoid while recovering from childbirth? Well, yeah, pregnancy. Do I have to have a baby shower? Well, not if you change the baby's diapers very quickly. Our baby was born last week. When will my wife begin to feel and act normal again? Well, when the kids are in college. Ways to know if you have estrogen issues. Everyone around you has an attitude problem. You're adding chocolate chips to your cheese omelets. The dryer has shrunk every last pair of your jeans. Your husband is suddenly agreeing with everything you say. You're using your cell phone to dial up every bumper sticker that says, "How's my driving?" Dial 1-800. Everyone's head looks like an invitation to batting practice. Everyone seems to have just landed here from outer space. You're not as nice as you used to be and used to be a witch. You're sure that everyone is scheming to drive you crazy, and the ibuprofen bottle is empty and you just bought it yesterday. Just something for humor. Okay, so that concludes our lecture for the female reproductive system. And I hope that you found this lecture very educational, fun for some parts, and enlightening. Again, if you are one of my students in one of my classes, you know exactly how to get a hold of me. Other than that, until our next lecture, sayonara, and I'll see you next time.